Hello, everybody. Thank you for everybody who is already here. My friends who are already saying hello to me. How you all doing? Somebody just had the gallbladder removed, so I'm wishing you the quick recovery from that. Hello, my friend Stephanie, who is here in the house. By the way, your subscription is about to expire. They sent me a message about this. My friend Nicole, who is a subscriber to this platform. How you doing? Joe, Decangelica, thank you for being a new follower. Have a day. Love hearing from you. I get home from the hospital. Well, okay. Oh, you are an RN. Thank you for everything you do, my different jewel. Thank you for the things that you do. Again, we are about to do the same thing. So thank you for the service. Thank you for everything that you do in the hospital to help people. But again, everybody who is already tapping on that screen, the people who are already giving us gifts, like Kathy underscore St. John, thank you for your gift. I appreciate you. Everybody else who is already here, thank you very, very much. And welcome to the great show, the GoJB Health Show. Today we're going to have a great ride with your dear brother here, Brother JB. Kathy, it looks like in 48 hours your subscription will expire as well. So if you could take care of that, if you want to continue to be a subscriber. Wilma, good afternoon, good evening. How you doing, my dear friend? My friend Panapla, it's been a while. I have not seen you here. Thank you, my friend, for being here. Everybody who is tapping on that screen, everybody who is very supportive to this platform, everybody who loves this platform, thank you for being here. And we are about to have an amazing time here. Today we'll be talking about some of the main reasons that could cause you to have a frequent urination. Some of the things that could make you pee so many times every time. Yes. Thank you, my dear friend Kathy, for resubscribing to this platform of GoJB Health. Appreciate you. Are you having issue you can't sleep at night, or do you know of somebody, maybe it could be your husband, your partner, who is having problem being not able to sleep at night? Yes, my friend Kathy, again, continue to provide a lot of support. This is Lucky Leprechaun. Thank you, my dear friend Sandra Diva, Queen Diva. Thank you for the roses. Appreciate it. Hello, my dear friend, the Niga. How you doing? My friend Sandra Diva 8 is continuing to show that support to this great platform, to this great show. The show of education, the show of the people, the GoJB Health Show. So what are some of the most common reasons? Again, you guys know usually we're going to talk about a lot of stuff here. But usually we start with something. We start somewhere because, again, we're here to answer questions. We're here to have a good discussion. Again, everybody who is tapping on the screen, I see you. I see who you are. I appreciate you. But let's talk about the main reasons that will cause you to not be able to sleep at night. What is the first thing that would cause me to not be able to sleep at night? Because I'm getting up so many times to urinate. Napogati, thank you for being a new, well, it looks like a new follower on Instagram. Thank you. Wow, look at that. I'm having a lot of answers here. My friend Sandra said caffeine. My friend Kathy said diabetes. My friend Sandra Diva says water. My friend Nicole says fibroid. Somebody says stress. My friend Brown Sugar. Brown Sugar herself. I love this screen name, by the way. Yes, my friend Marogar 3. How you doing? I'm glad you're back. It's happy to see you here today. Certain medications, yeah. A urinary tract infection. Hello, JB. I missed the beginning. My friend Josephine, if you missed the beginning, no worry. It will be posted on YouTube. Later on, it will be all available on YouTube, so you will get to see the whole show on YouTube. No worry. Yes, Mom23527. Hello, how you doing? Yes, I'm doing great. Thank you for being here. I'm happy that you're here. Everybody who is here and who are sharing, who are tapping on that screen, appreciate all of you. Anyway, I have a lot of great answers, a lot of my great people. Somebody has surgery on Tuesday for fibroids. Well, how is your recovery? I'm hoping things are going well. Again, I am hoping for speedy recovery, like I wish for my other friend who had a gallbladder removal. My friend here says overactive bladder. Remember, we're talking today, we're looking at some of those things that could keep you up at night. Some of the things that could cause you to be peeing so much and you cannot go to sleep at night. Well, let's start. Among everything, so we're going to look at number one, diabetes, like my friend said. So if you are diabetic, or if you are peeing so frequently, if you're watching this show and you are peeing so frequently, it could be something that my friend here, my friend Miss Lee, how you doing, my dear? So if you are having that issue, you may want to, when you go to the doctor next, you may want them to be checking you for diabetes. Again, for those of you who've been following the show, you know you check for diabetes. Queen Lady, my dear Queen, thank you for being here, my dear. I'm happy to see you always. So if you are having that frequent urination, when you go to the doctor, you may want them to check your A1C. An A1C is a hemoglobin A1C. This is a test that you do to see if you are diabetic. Being diabetic can cause you, this is one of the reasons that could cause you to be having frequent urination. So all night, so many times a night, you just keep getting up and keep peeing. Obviously, things like drinking a lot of water, it makes sense if I know that I drink excess of water. So yes, thank you, Queen Lady. So if you drink excess of water, obviously it would cause you to go to the bathroom. That's pretty normal. But what I'm talking about here, I'm talking about circumstances where you know you didn't drink excess of water. Thank you for the new people who are following me. Again, if you just join, I encourage that you follow so you know whenever I am live. And also, I post at least 1 to 2 educational videos on this platform. If you have not followed me on YouTube, on Instagram, please do so. I also have a lot of videos on those platforms, but also I got this show posted on YouTube. Right after the show, I get it loaded there. So please help me to grow that platform as well. So, but anyway, we say the first thing that would cause you to be peeing frequently, thank you, Miss Lee 03, for sharing the life. That will cause you to pee frequently. The number one thing will be if you are diabetic, especially if you are uncontrolled diabetic, because usually the people who pees frequently, like I was talking yesterday, it's because those people, their blood glucose is not controlled. There's so much sugar in their blood, and the kidney is attempting to remove that sugar. This is why you're spilling sugar in your urine. This is when we check a UA, check a urinalysis. We just take your urine, we do a dipstick, we do a quick test right here in the office. Is going to show that you have +2, +1 glucose in your urine. Usually your urine shouldn't show glucose. So if it shows glucose, that's already a sign most likely you are diabetic. Now, the number 2 thing that would cause you to be peeing so frequently will be if you have a urinary tract infection, like some of our friends were saying here. So if you have an infection in your bladder, then it may cause you to be having those frequent urinations. So those are so far 2 of the things that happens if you that will cause you to actually be peeing so frequently. Mom23, thank you for being a new follower. My friend Mildred in the house. How you doing, my dear friend Mildred? How you doing? Mildred, thank you for liking the live, by the way. Thank you for pushing on the screen. Appreciate you. Next thing, I know that I may have a lot of queen watching here, but remember, most of the queen, they have a king next to them. So what if you have prostate issues? So if you feel like you're sitting here, one of my queen watching here, and your king is getting up every few minutes, getting up to go to the bathroom, you may want to think, is your prostate okay? My friend Chelsea baby, is that what it is? Yeah, Chelsea baby, my dear friend, my dear queen, thank you for the rose, thank you for the gift, appreciate you, and thank you for being a new follower to the great show, the Go JB Health Show. Go JB Health. My friend, go ahead, ask me a question. That's why I'm here, okay? Somebody say, what about constipation? Yeah, we could talk about constipation as well. My friend Jennifer. Anyway, so if you are at home and you are sitting next to your great king, you at home and our great friends, and this guy is just getting up to go to the bathroom so frequently. So this could be, especially if they're older, they may have prostate issues. When you have prostate issues, like you have benign prostate hypertrophy, we call it BPH. So then what happens is the prostate is inflamed and it's pushing on the bladder, then causing you to pee so frequently. It depends on how it is, my dear friend Miss Lee. My friend Jack M113, thank you for being a new follower. We appreciate you. Kathy, welcome back. I'm happy. Always, Queen Kathy. Alberta, thank you for being a new follower. Keeps me humble. What a beautiful screen name. Thank you for being a new follower to the Go JB Health Show. I believe we have a video posted on our page about the Graves' disease, because I think we talk about this, that we were supposed to get a video posted there. My friend Amina, how may I help you? What was your question, my friend? You asked about constipation. My friend Sunita, good afternoon. How you doing? And my friend Kathy will get back to you on that. But I believe we already had it posted there, but I'm going to check on that. Somebody has an important question. Usually we have an important answer for you. Queenie Lily, thank you for sharing the live. Appreciate that. I have a friend here who is having a problem with menstrual cycle. 8 days ago they had it, and now again, here it comes again. So as I said, there's a little video that I have posted that I talk about menstrual cycle. It is not normal for you to have your cycle twice in a month. And if that's ever happened, hello Abby, how you doing? If that ever happened, that means your body is trying to tell you something. Trying to tell you that you need to check something out. Something is just not right for you to have that period 2-3 times a month. It should be once a month. So we need to find out what the issue is. Now, just like I had a patient here today that has their period is going on and on. So usually when you have that, we want to also think about being pregnant. So people don't understand that if you are pregnant, if you have a miscarriage, it could cause you to bleed, and you keep bleeding. So it could kind of deregulate your cycle. Obviously, that's usually what pregnancy does. It just make you stop having your period. However, if you have a miscarriage, you could start seeing your period again, and it could keep bleeding. So what happens is until you go and do a DNC, which is when you go and clean everything up, so then you may still be dealing with that. So usually that's when I ask you to do a pregnancy test, and if we feel like you're pregnant, gotta rush to the emergency room and get a cleanup. Now, first thing that we should do for my friend who is having the period twice, the first thing that we need to do, we need to check some blood work. How do you get those blood work checked? Maybe your question. But all you do is you go to your primary care. That's a great place to start. You could go to your primary care. They could do some testing for you to make sure there is no abnormal issues going on with your hormone that would be causing you to be having your period twice a month. And I know that in one of those videos, I told you exactly which hormones deal with your cycle. So therefore, those are the hormones that they will need to get checked. Now, if you have a GYN, it's even better to go to them and have them check it. Just keep in mind, there's a lot of other issues that could actually, my friend MMW400, thank you for liking the live. I see a lot of people liking. I see you, the people tapping on the screen. I appreciate every single one of you. But now, what I was saying is, menstrual cycle can vary with a lot of situations. So what happens is, my friend get dizzy, fell off balance, recommended birth control. Yes, so I'm gonna say something about the birth control in just a minute. But what I was about to say is my friend Abby, thank you for sharing the live. Appreciate it. Yeah, so what I was about to say is when menstrual cycle, there's a few things sometimes that could affect it. So that's why my friend who said that, he's having that issue, you also may want to think about yourself, think about what you do. Stress can affect your menstrual cycle. Hello, my friend, Classic Lady. Man, I have so many beautiful people here. Classic Lady 1. Amazing. How you doing? So the thing is, if you are under a lot of stress or you change environment, so sometimes, because I don't know if you guys are aware, but when you have a group of ladies that live around each other, usually they all have period around the same time. So they all ovulate. The ovulations over a couple of months, it would be the same. So everybody's gonna be on their period pretty much around the same time. My friend Longos, how you doing? Good evening. So they would have that period around the same time. So I'm just saying that it's just, you may say, oh, I don't understand how my period changed. Well, it may be if you move from one environment to the other, now you met other females that are living in the same environment, there could be some changes. There could be some changes that you see, and it may not be necessarily a problem. So I'm just saying this just in case, if you could think of your life of some changes that you had made, then that could possibly cause that. I don't know. I'm just saying. I'm just saying. I just wanted to bring that out there. That's all. My aunt just got diagnosed with dementia, and it's a death sentence. I'm so sorry. This is so difficult. I know how difficult that is. I deal with a lot of people with dementia, so I do know how difficult that is. I do know. I have pain going from my backside, going from my side to the back. What do you think? Okay, so my friend who has pain, number one, we're gonna assume that you didn't hurt yourself, you didn't injure yourself. We're gonna ask you questions like, do you have lower abdominal pain? Do you have issue with like urinary issues? Do you have any urinary issues? Do you think you were having a UTI? The reason I'm saying this, there is a pyelonephritis, as you guys can tell. I have a video on this. If you could tell, I have a video about almost most of the stuff on my page. But pyelonephritis is when you have an infection that moves from your kidney, from your bladder up to your kidney. So that sometimes can cause some type of flank pain. Again, that's one. It may be if you have any pinched nerve, it could cause that. So it's so many little things that could cause this. But I think the best thing is you need to be assessed. You need to go to your doctor, get a proper assessment, so you see exactly what is causing this pain. It could even be something like I lay in the bed the wrong way, or maybe I'm laying in the bed, I am holding a laptop, or the mechanic of my body. Because again, what I want you guys to think is always think of ways that I could, before I even think about, oh yeah, I need this pill. Well, let's see what I can do first. I think that is extremely important, because a lot of the time we don't look at what we can do, but we go ahead and try to fix everything with a pill, which is not always what we need. People just go over the counter and start taking all these medications. I'm not saying you shouldn't be taking medicine, but you need to take it when you need to take it, not when you don't need to take it. Yeah. So if you have a nerve pain, just like my friend is saying, sciatica, so all these can cause that. I do have sciatica. Okay. So yeah. So if you have sciatica, yeah, that could cause this pain. But again, if it's a new pain, my friend Tandy, I'm glad you're here. You're not late. You're good. Because remember, this will be posted. The full show will be posted on YouTube anyway. So no worry about it. Okay, so I had an advice for my friend that talks about birth control. So one thing that I want you guys to know, birth control pills, I'm going to look at pills. Birth control pills are good, but birth control pills can put you at risk for blood clot. Now, how do I know if I'm at risk for blood clot if I'm taking a birth control pill? How do I know? Everybody who is tapping on the screen, I see who you are. Thank you for those little red heart. I appreciate them. 10D, I see you. Mildred, I see you. All these people who are tapping, appreciate every single one. So the advice that I was gonna give is about people who are taking birth control pills. So birth control pills, there is nothing wrong with birth control pills. I used to take Depo. Okay. So, however, the problem is for older people, once you hit in the 35, it causes a very high risk for developing blood clots. And it's proven. I've seen patients that come right here. They end up with a blood clot after they started taking those birth control pills. Brown Sugar herself, thank you for your sharing. Thank you for your liking. I appreciate you. Well, the thing is, my dear friend, I have not seen you in a while. My dear friend, Quelia, thank you for the big old heart that you just gave me. Appreciate you. So if you are going to be on birth control, if you are in the 35, 40s, it's better to find another option. Over here, so far, we are planning on possibly do those implants, but we don't do those implants here. We only can do the pills. So if you come here, like I had somebody here today, if you come here and you are in your 35, 40s, and you want me to give you pills, I'll tell you, I'm going to refer you to GYN so they could possibly put an implant. Okay. So put an IUD or something like that. So I will refer you for other options because of the risk of blood clots. Do you guys know what blood clots are? Blood clots can cause you to end up with a pulmonary embolism, a heart attack. There's a lot of things that could cause. So my dear friend Quelia, thank you for being here. Once again, one of the subscribers to the Go JB Health. Go JB. Go JB. Agnes Canoville, thank you, appreciate you. Who said bless you? Thank you very much. IUD is pretty safe. Yes, pretty much. Yeah, IUD should be fine. I mean, it's a little bit more invasive because you have to put it down there, but hey, it's pretty safe. Pretty much for people who are not used to an IUD. An IUD really, it's a method of blocking the fallopian tube. Because remember, what we do is usually to get pregnant, like if you watch some of my videos, you will see that once again. For you to get pregnant, you need the fallopian tube to be open. So then what happens with the IUD? They just go there. It's like more like, you know how they do tubal ligation, like they tie the tube. So it's pretty much, you don't tie the tube, but you go and block the tube. So that's what the IUD does. And really, whenever, if you want to be pregnant, all you do is go ahead and contraception, 40, which contraception? Yeah, so usually if you are 40, it would probably be better to go with something like the implant or the IUD or something like that. But again, just so you guys know, I'm a family practitioner. I'm not a GYN specialist. That's why, as I said, like even today, I had a patient that came here and I felt like the option of the pills would not be the best for her because of the risk of developing a blood clot. So therefore, I refer to a specialist, to a GYN to see what options they have. But usually an IUD is a good option for somebody who is older. Well, if you 47, yes, 47, I would not even touch the pill. Because if you're touching this pill, you are looking for trouble. My friend here says those pills made her feel off. Yes, I've seen some people when they take those pills or even the implants. Some people, it just makes them feel a certain way. Because remember, this is hormones. So again, we have that hormones. We know that female hormones, there's a lot of things that it does. You know how you feel, you know, when you're ovulating, you have different ways. Those hormones, they have a lot to do with how we behave, how we do things and all that. So when you are taking anything that is doing something to these hormones, then my friend dear Renee Clark, you thought I wasn't gonna see you. Thank you for liking the live. Thank you for tapping on the screen. Appreciate you. But yeah, so any of these, when you take those pills, because it's hormones, so yes, it could make some changes. Like my friend Nicole was saying, it could cause you to feel a certain way. For some people, many people don't tolerate it that well, you know, so. Somebody say, is Depo shot? Yeah, Depo shot is pretty good. That's a medication that has been around for a good while. As long as you don't do like this patient who said, well, I just found this somewhere somehow. So you need to make sure whatever you find, that you find it, you get a prescription, you get it evaluated by your doctor to make sure whatever you are taking is safe for you. Well, my friend Agnes, who just gave me that very nice little first gift, appreciate you. The finger heart, thank you for the finger heart, appreciate that. For those of you who are just joining this show, my name is JB. I'm a family nurse practitioner. And I'm here educating my peeps. Now, if you're new to this platform, I encourage that you follow me. If you follow me, you're going to know whenever I am live. It's all about healthcare. It's all about your body. It's all about understanding how to take care of yourself. There's a lot of information. Queen Lady giving me those beautiful roses. My dear Queen, thank you very, very much. Okay, guys, sorry about that. I had a little interruption here. So yeah, what is the best? What is the best family planning at age 43? Well, there's a lot of things. There's a lot of stuff that we have to look at to see what's the best for you. So some people, it's like, how compliant are you? How much do you want to implant something in your body? Or how much do you want to just use protection like condoms? All these are ways to plan. So again, it's very individualized, very, very individualized. People have different preferences, right? My friend Quillia, who is providing those beautiful roses, appreciate you, my dear, my queen. Anybody who is new here, please follow me. Let's go with JB. As I was saying earlier, I'm a family practitioner. My job is to talk to my peeps every day. If you miss any part of this show, it will be available on our YouTube platform, YouTube channel. So if you have not followed me on YouTube, please go over and follow me. Just know you could always become one of the biggest supporters to this platform and becoming one of my friends on TikTok. One of my friends on TikTok, where you could actually direct message us by just becoming a subscriber. Just click on the gold button up top and you could become a subscriber. Again, that's a way for you to support a great cause, a cause of educating people, a cause of saying yes to something that is very positive. My dear friend Quillia does say, let me come are you, I'm not sure what you mean, my friend, my dear queen. But yeah, guys, so today I was very happy to see so many people once again, to come by and show the love to Go JB. I know it was a lot of questions. I'm pretty sure that I didn't get the chance to get to all the questions, but again, we're here every day. So if I miss your questions now, number one, you could always look in either YouTube or somewhere where I post videos. Most likely your answer may be there. But the other option is for you to just join me tomorrow, and then you could always ask the question. We're about to end this show. Just so you guys know, you could always become a subscriber by clicking on the goal. Somebody giving me some beautiful things here. It's called Machi Machi or Machi Macha. So Machi 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 Macha. Thank you. I need to acknowledge that person, you know. I need to acknowledge that person. Tomorrow we'll be here at 2 o'clock. We've been doing 1 p.m., but we're going to try to do 2 p.m. because 2 p.m. Eastern time because of somebody, Agnes Corneville. Thank you for being a new subscriber to Go JB Health. Again, this is a different level of commitment to say yes, go JB. I really appreciate you, my dear Queen Agnes. Thank you. Later on today, after the show, you will receive a message from me. It will be a welcoming message, and this would allow you to become a friend or my friend on TikTok. My friend Emerson Baby, that's who gave me the match. It's called match. So, but yeah, by different Agnes, later on today, after the show, I'll send you a message. It will be a private message that I'll send you to welcome you as a part of this small group of those people who are subscribing to Go JB, and I will open the door for you to direct message me. And again, it will be an opportunity for you to help me, give me ideas. A lot of the things that I come up with here, it's a lot of those people who subscribe. Sometimes they will send me messages, private message to say, hey, you know, JB, maybe we should do it this way. So I appreciate you once again. Thank you for subscribing. Anybody, you could just click on the subscribing button on top and becoming a subscriber. I know I don't emphasize on this so much, because of the fact that I'm so excited when I come here to be sharing informations with my brothers and sisters. So really, I'm not big and emphasizing on people can become a subscriber to this platform. But again, once again, my dear friend Agnes, let's give it up for her. Thank you for being a subscriber to this platform. I appreciate you. Later on, you're going to get this message from me that would open the door so we could direct message. Thank you. Thank you, my dear. Everybody who is making the screen red, I appreciate y'all. My friend Twani, thank you for being a new follower. We appreciate that. I think somebody else was asking about lupus. You know what? Next topic for tomorrow, it's going to be lupus. Tomorrow we'll talk about lupus. And I do believe we have those videos posted already on our page. But you know what? We'll talk about lupus and we'll still answer a lot of other questions like when we come. But let's make it the number one topic tomorrow. Why not? You know? Patty Cake, thank you for being a new follower. We appreciate that. So, again, guys, once again, I am left to say thank you to every one of you. Everybody, I don't know if I start naming every single person, it may be a little hard for me, but I have so many queen here who've been very supportive of us. Been liking what we are doing here, and we'll continue to do it like I always say. I guess today, I was about to say, I guess today I can get to put my glasses on, but guess what? I do have my glasses next year. It's about time, glasses time, huh? There we go. We can have a lot of fun while we're learning. We don't have to make it like so boring. We could still have fun. Jessica, I'm doing good. How you doing, Jessica? Josephine, thank you. I appreciate you. Mildred, who is tapping? I have so many people tapping. Queen Lady in the house, always. Always. Rheumatoid arthritis. Don't worry, we got you. We got you. We'll talk about it for you, Queen. Queen Patty. Patty. My friend here, Agnes Cornerville, say, was late, but God bless you. And we'll see you tomorrow once God permits. Well, thank you very much. God bless you too, my friend. My friend here, definitely so. I like that. Who says you are looking, you are so good. Thank you. And plus, I have this ability to talk, to share with people that I love, with my brothers and sisters. There's nothing that I could do better than that. Taking this hour out of my work here just to do this, just to have this conversation with so many people like Beverly Thomas, How you doing? Good afternoon. So many people like BOP, my dear friend, who is liking the live. Thank you, my friend. A lot of the time, you have those friends here. You don't even know that they're here, but they're here. Sometimes so many things going on, you can't even tell. But the only thing that you know that you are strong. Once you have people like Nicole behind you, BOP behind you, you have Juliet behind you, you have people like Stephanie behind you, you got Mildred behind you, you got Queen Lady behind you, you got Beverly Thomas behind you giving you roses. Then you know what? You're not afraid. You're gonna go JV Health. Let's go. Go JV Health. We will go together. Yeah, with Patty, the queen in the house. Say go JV Health. We're gonna go together. Yeah, you got all this queen going with you, you know, and that's what's happening here. You see, they are tapping on the screen. They're giving you roses. They are subscribing. Look at that. You got Shushu 1015 who just followed us. You know, they are following. They are tapping. They are gifting and subscribing. And they are saying go JV Health. Look at that. Look at a beautiful bio, my friend Boyopi. Look at that. A great heart from a queen. So you think I'm gonna be scared? Of course not. Because my queen, they love what I'm doing. So I'm gonna keep doing this. I'm gonna keep educating my people. Nobody could change my path, right? My friend here who said, love your voice. Wow. I love your support, my friend. Beverly Thomas said, we having a party. But you know, the thing is, hi, my friend, user 31. How you doing? Thank you for being here. Here's the thing. I think we could always make the best out of where we are. We could always have fun in anything we do. We don't have to come here and it's like, I don't have to be that way. You know what I'm saying? I think it's more fun to just come here and smile, you know, have fun. It's like I'm not talking to robots. I'm talking to people, especially, you know, you're talking to queen. When you're talking to a queen, there's a way to behave yourself. You know what I'm saying? You understand what I'm saying? I'm doing good, my friend, user 31. Again, if you guys, anybody who just joined, please follow me. And also, if you haven't followed me on YouTube yet, please subscribe me on YouTube. And just so you know, the show, the full thing, the full thing is gonna be available tonight on YouTube. Well, this evening, actually, maybe within an hour after the show or so. It will be fully available on YouTube, so you will be able to watch the whole thing. But as I was saying, it's like I think people may. I don't know how certain people may take it, but the way I look at it, I could do this and I could do it fun. We don't have to be. We don't have to be so. We could just do this, do it as fun, be real in what we're doing. That's who we are. We just say who we are. That's why it's like I don't have any problem somebody asking a question here, and I don't have any problem telling you that, hey, Renee Clark, how you doing? You are just being yourself. That's why we love about JB Health. Well, thank you very, very much. As I was about to say, and my friend here say, you sound like a disc joker. That work on the radio. Well, I work on people. I work on treating people. I fix people. That's what I do. So the thing is, as I said, it's no problem for me to come here. And if you ask me something and I have to tell you, hey, I'm not a GYN. So I'm not a specialist. This is where I am. This is what I do. And again, like my friend was saying here, obviously I'm an open book. It's like I tell you where I am. It's like I'm not some type of robot behind behind TikTok talking, so, but I'm somewhere. If you want to know where I am, come to Atlanta, come to ATL. And you come right here in Smyrna, right across from the train track on Atlanta Road. That's where I am. All Care Health Clinic. That's where I am, right here. That's where I am. That's who I am, okay? We're not hiding anything. That's where we are, And we're having fun. I love having fun. I love music. I love music. People think, oh, you love, well, I love music. Yes, I fix people. I love music. I love having fun. I love dancing. So, yes, I love all these things. I love people. I love educating people. That's why I'm doing what I'm doing here. I love technology. So, really, yeah. Oh, somebody give me a hat. Look at that. Wow. Amazing. Thank you. Thank you, my friend. I appreciate you. Somebody live in Albany, Georgia. That's kind of a distance, but if you want to take a drive here, you want to see what's you want to see Go JB, you want to see JB in person, just come here. Come here. We'll sit with you. You come here, we'll hang out. We'll sit down. We'll talk. We'll show you around. We'll show you the office and see where we are. Well, actually, hey, let me tell you. So if anybody who is watching here, I guarantee you, if you are in the area and you say you are here, I could probably put you on the air. And so people could say, hey, you remember I used to talk about this person? They're right here with us. So, yeah, what will be an amazing thing. Tandy, I see you, Tandy. I see what you're doing, Tandy. I see how much you appreciate us, Tandy. We appreciate you too, my dear. Beverly Thomas. A queen, a special queen. My friend here is asking, what do you use for sciatica, for nerve pain? Well, if you have nerve pain, you gotta take some medications that helps with nerve. The most common ones are Lyrica and gabapentin. Those are the two ones that are the most commonly used. People, they keep that thing like red for real, like Tandy, like she kept tapping on this thing. Same thing with Queen Lady, by the way. Okay, people. Okay, my queenies, my dear friends. Muscle spasm. So if you have muscle spasm, you need to take a muscle relaxer. Usually you go and get a prescription for a muscle relaxer, something Robaxin, Flexeril. Again, all these medications. I am licensed in the U.S., so therefore, you gotta need a prescription. I don't know what country you are, because this show is for the whole world. But most of the things I'm saying is like, I'm assuming that most of those people are in the U.S. You may be somewhere where you could go to your medications. I don't know, but all I know is any of these medications that sometimes I would say out here. I'm glad I caught you here today. Me too, my friend. So everything that I'm saying here, I'm saying it based on the U.S. system. That's where I'm licensed, so that's where I practice. So again, I'm assuming that you go to your doctor and you get a proper diagnosis and you get the proper medication. You get a prescription. That's not a medication you just go like this over the counter. My friend in North Carolina, she say, thanks for sharing. Yes, North Carolina. Praying. Well, hopefully soon you find a doctor, my friend. You need one, right? You need one. You do need one. But anyways, for so many people who showed love here today, that was a great day. Every day is a great day, actually. With these people that I have, it's always a good day, right? Yeah, so if you are having pain, if it's spasm, yeah, ask your doctor about Flexeril. That's a great place to start.
Go JB, go JB, help. Go
Again, everybody, my whether you are a queen, well, it's queen. It's like I have a lot of them. But you're a king, you're a prince, you're a princess, you are a supporter. Whether you are able to subscribe to this platform today, whether you say, well, I'm not going to subscribe today, maybe tomorrow, maybe another day, really, whether you give me that beautiful hat, or you give me those big hugs, you give me those roses, you give me all these gifts, you give me that, what's it called again? Not the tap, but it's called, yeah, there's somebody who gave me something, match, whether you give me the match. So, whatever the gift that you give me, I want to say thank you. Really, that thank you is just a thank you. It's more about the gift, but it's about the gesture, you know? It's more about the appreciation. Sometimes maybe you guys may not understand how much appreciation that I have for you guys, for somebody like Patty, who's been giving us a gift all throughout the life. So I appreciate you guys, and I love that you guys are helping us. You guys are helping that platform of GoJB. So Willie, I always have to give that little speech to say thank you to every single one of you, the people who are tapping on that screen to make us reach like 17,000 well, I appreciate every single one of you. I appreciate the love. I appreciate the support. I'm hoping that we could continue to work together. I'm hoping that we can continue to educate people together. I'm hoping that we can continue to do this work that we are doing, this great job of educating our population. This is a very, very, very important job that we need to do. And again, you helping me is a great thing, because you help me so I could reach more and more people. Again, if you did not subscribe today, you're going to have the option of subscribing. You can only subscribe, by the way, while we are live. So you're going to have the option of subscribing maybe tomorrow or anytime. So tomorrow we'll be here. Again, once again, thank you. Thank you for the love. Thank you for the appreciation, everybody. I'm ready to say that I will see you guys, that I'll see you guys tomorrow. Once again, thank you, everybody. I appreciate you all. Everybody who've been tapping, everybody who've been sharing, every one of you are so important to me. So thank you, everybody. And y'all have a great evening. Stay in good health. Continue to follow GoJB, by the way. GoJB is on YouTube, on Instagram, on Twitter, everywhere. Continue to like GoJB. Continue to share GoJB with other people, because again, sharing me is really sharing knowledge with other people. So let's share the knowledge. Let's share the love with other people. Thank you, everybody. I love you all, and y'all have a great day. I'll see you later.
GoJB, help.
This concludes our great health education show for today. Thank you very much. Thank you to every single one of you who spent this precious time with us. Again, if you're new to this platform, we encourage that you follow us so you know whenever we are live the next time. The show comes on every day, Monday through Friday, 1 p.m. Eastern Time. My name is JB. I'm a family nurse practitioner who believes in educating his people, who believes on supporting his brothers and sisters by sharing his knowledge with them. If you missed the show again, it will be available on our YouTube channel. And if you have not followed us on YouTube, Instagram, or Twitter, we encourage that you do that now. Again, once again, the people who tap on the screen to give us the likes, the people who shared the video, the people people who became new followers, those who gave us gifts on the show, the roses. We want to say thank you to every one of you. Thank you to the people who subscribe to this platform. We want to say thank you to every one of you. Thank you for believing that together we could promote health, that together we could educate hundreds of millions of people. I want to say thank you to every one of you. I really appreciate the support that I have all throughout this country, but also even all over the world. We have a lot of people supporting this great project of education. Again, thank you for being here. Until I see you the next time, you stay with great